According to the Department of Health and Human Services, 8.6 million people in the U.S. have at least one serious illness that's caused by smoking. When you smoke, it affects every part of your body to some degree. Your nails will turn yellow, as well as your teeth. You will develop gum disease, your blood vessels will restrict, putting you at a higher risk for strokes, and smoking greatly increases your chances of getting many different types of cancer. Throughout this speech, I'm going to tell you about some ways to quit smoking for you or a loved one. If you don't smoke and don't have anyone in particular around you who does, this speech can still pertain to you. Not only is smoking harmful for those who do it and those around them, but is also harmful for our environment. Cigarette butts are the most littered item on earth. Luis Carlozo states that in his article, cigarettes 1.7 billion pounds of litter. Both of my parents smoked while growing up, so I do have some first-hand experience with the effects smoking can have on people. I'm going to tell you about the negative effects smoking can cause to you and those around you, and inform you of some of the different options available to help you or your loved ones quit. I'm also going to tell you a little bit about what we can do to help lower the number of cigarettes littered throughout the day. The first topic I'm going to start off with is the negative effects that smoking can have on you and those around you. While reading an article by the Department of Health and Human Services, it states that a single cigarette contains 4,800 chemicals, 69 of those are cancer-causing chemicals, and secondhand smoke contains 7,000 chemicals, including 70 cancer-causing chemicals. There are several different unsafe chemicals found in cigarettes and the smoke that follows. To name a few, for example, there's benzene, which is also found in gasoline, carbon monoxide, which is in car exhaust, lead, which is found in old paint, and formaldehyde, which is used for embalming fluid, as well as pneumonia, which is also used for cleaning products. There are many more harmful chemicals put into a cigarette. I strongly encourage you to go to therealcost.com and check out the remaining chemicals on there. Not only are you inhaling these unsafe chemicals into your body, but when they are released, those around you end up inhaling them when they breathe. The Center of Disease Control, CDC, states that estimates show smoking increases the risk for coronary heart disease by 2 to 4 times, stroke by 2 to 4 times, men developing lung cancer by 25 times, and women developing lung cancer by 25.7 times. Lung cancer, however, is not the only type of cancer that smoking can cause. It can also cause acute myeloid leukemia, bladder cancer, kidney cancer, cancer of the larynx, mouth cancer, cancer of the pharynx, stomach cancer, and cervical cancer. And these are only some of the risks that smoking can cause to the body of the person smoking. Secondhand smoke is also a factor in considering when talking about the negative effects of smoking. Studies have shown that secondhand smoke can be linked to several different types of cancer, according to the American Cancer Society. Their article states that due to the harmful chemicals non-smokers inhale, there is no safe level of exposure to secondhand smoke. Not only does smoking damage your health and those around you, but it also causes trouble for the environment. When a cigarette is thrown out of a car window or on the ground before entering a store, it can take 18 months to 10 years for that filter to decompose. As I stated previously, cigarette butts are the most littered item on earth. And an article posted by Terry Martin states that that's not the worst of it. The filters are dangerous to our environment, not just because they don't decompose for years after being thrown down, but because the chemicals inside of the filters seep out onto the ground, polluting waterways and damaging living organisms that come across them. And some believe they have found a solution to help with the litter and release of toxins into the ground. Now I'm going to discuss with you several ways to quit smoking. There are many different programs that you can go to. There's patches and medicines that you can partake in to help you or a loved one quit smoking. One of the many methods is the NRT method, which stands for nicotine replacement therapy. The cause for smoking is because people get addicted to the nicotine put into cigarettes. So this type of method provides you with a low level of nicotine so that you can wean yourself off of it without the poisonous chemicals present in cigarettes. They also have many different forms of NRT to help you: skin patches, chewing gum, oral strips, and nasal and mouth spray. None of these forms are more effective than the others. You just have to find which one works best for you personally. which is what different programs do that help you quit. They go through with you and help you see what different methods best suit you and will aid you in quitting. Electronic cigarettes are also an option to help you quit smoking that doesn't include the chemical and tar smoking a cigarette would. A solution to the littering of cigarette filters would be to place more disposable bins around for those who do smoke to dispose of their cigarettes properly. Studies found that if we placed bins in more areas, such as in front of a store or outside of transportation areas, that the number of filters littered decreased by 9%. If we were able to do that in more common areas, then the amount being littered would significantly decrease. Now I'm going to tell you some of the positive effects that quitting smoking will have. According to an article posted by Rachel Nall and RN, this is what happens to your body once you decide to quit smoking. Within the first 20 minutes, your blood pressure will drop back down to normal. Within the first 8 hours, the carbon monoxide will return to normal levels and your oxygen will start to increase to normal levels. 24 hours after your last cigarette, your risk of heart attack has already decreased due to the reduced constricting of your blood vessels. 48 hours after your damaged nerve endings start to regrow and you will start tasting and smelling things better. 72 hours after, you will be breathing more easily due to your oxygen levels increasing. 2 weeks after you quit, you will only be breathing easier but also walking due to improved circulation and oxygenation of your lungs. And your lungs will be functioning 30% more. 6 months after smoking, you may notice that you're not coughing up as much mucus and phlegm because your airways are much less inflamed. 3 years after quitting, your chances of having a heart attack have decreased to that of a non-smoker. According to the University of North Carolina, 5 years after you've quit smoking, your lung cancer risk has dropped half compared to when you were smoking. Not only is the change to your health a main factor in quitting, so is your finances. When you quit smoking, you save so much money in just 1 year. If you smoked a pack a day, the average pack cost about $5. Within a week, you've spent roughly $35. Within a month, roughly $1,050, and within a year, $12,500. So when you quit, that's an extra $5 a day, $35 a week, $1,050 a month, and $12,600 a year. In conclusion of this speech, I hope that I was able to make you look hard at the effects smoking has on you and those around you, as well as the environment. There are many different methods you can use to quit smoking if you or a loved one have a desire to do so. I may not be able to get everyone to stop smoking with my speech, but I do hope that I persuade at least one person to put the pack of cigarettes down so that they may live a healthier life. Thank you for listening.